Hello, thank you for joining us for our Hunter New England and Central Coast Expedited Specialist Pathway webinar. My name is Phoebe James and I'm a Professional Development Officer with the Hunter New England and Central Coast Primary Health Network. Before we begin, I would like to acknowledge the traditional custodians of the lands I live and work on. For me here in Newcastle in Newcastle in Australia, it's Awabakal and Warramai land, and pay my respects to elders past, present, and any First Nations people joining us today. I just want to mention before we start that this session is being recorded. The recording will be available in the Education Library on the PHN website in the next week or so. At the end of the presentations, we'll have a Q&A session. Please put your questions in the chat box, and if we have time, we will cover them. It's now my pleasure to introduce Jeff Innes, Project Officer, Workforce Planning for the PHN. Jeff will introduce our other speakers. Thanks, Jeff.
Thanks, Phoebe. Thanks, everyone, for being here so early or so late in the evening. We have some really great speakers with us today from the Primary Health Network and speakers external to the PHN who work in our region. Dr. Paul Craven from the Hunter New England Local Health District is the Executive Director, Children, Young People and Family Services, Executive Director, Medical Services, and Executive Director, Networks and Streams. Very long title. Dr. Michelle Redford is a general practitioner, originally from the UK, who came over to Australia about 10 years ago. And about a year ago, she joined the PHN as our medical director. Though she still practices as a GP as well, it's great to have her here to lend her knowledge. Dr. Eamon Al-Dethi is a general practitioner from the UK who has very recently come over to our region through the Expedited Specialist Pathway about a month ago. He's just started working at Swansea Medical Centre. We're really grateful to have him here to share his experience on the pathway. Lexi Vasey is the acting manager in our workforce team here at the Primary Health Network. And we are really thrilled to have two community connectors here as well. Community connectors operate in some of our regions in our footprint and offer an amazing free service that helps to settle essential workers moving into their area. We have Katrina, who is from Muswellbrook, which is part of our Upper Hunter region, and she covers several surrounding areas as well. We have Kate, who is the community connector for the Mid-Coast region, which includes Taree and surrounds. It's great to have Kylie with us, who is the Expedited Pathways lead from the Royal Australian College of General Practitioners. For the agenda of today's session, we will be talking about the Primary Health Network. We'll go into some detail about what the Hunter New England and Central Coast Primary Health Network is and why we are running this webinar and how we can help. We'll also discuss our region and where we are located within Australia. We'll do a brief run through of a flowchart from the Australian Medical Board and what the Expedited Specialist Pathway process is. The PHN has some grants for general practitioners coming to our region through the Expedited Specialist Pathway, so we can give some more information and resources on that. Dr. Paul Craven is going to speak about the Hunter New England Local Health District. Katrina from the Muswellbrook region and Kate from the Mid-Coast region will each have some time to discuss their areas. And Dr. Redford and Dr. Al-Dethi will discuss their experiences in moving from the UK to Australia, the differences in lifestyle and practicing in Australia compared to the UK. Kylie from RACGP will discuss RACGP's role and how they can support you on the pathway. And as Phoebe mentioned throughout the webinar, if you have any questions, please drop them in the chat and we'll have some time dedicated at the end of this session, hopefully to go through those questions. And finally, we'll end you at the end of the webinar by leaving you with some resources to help you. So who are we? The Hunter New England and Central Coast Primary Health Network is a not-for-profit organisation funded by the Commonwealth Government to improve the efficiency and effectiveness of the primary healthcare system. The Hunter New England and Central Coast Primary Health Network is one of 31 primary health networks across Australia. PHNs are not a direct provider of services. We work with healthcare providers across our region to deliver a range of primary healthcare services. The aims of our PHN are to identify and address health needs in our communities, support and develop improved healthcare delivery in the primary care sector, develop and implement improved care pathways and models of care, and commission health services to communities to close service gaps. So how can we help? We can link you with the right resources and people. We are not a recruitment agency. However, we can help connect you with practices that are seeking a GP through the expedited specialist pathway. We are providing grants that are available for GPs coming to our region via the expedited specialist pathway. I'll discuss more on this later. We have some great speakers with us today who can speak to their experiences, but cannot give immigration or legal advice, nor can we speak on behalf of another organisation. Where are we? The Primary Health Network's Hunter, New England and Central Coast region stretches across 130,000 square kilometres from the Queensland border in the north down to and including the Central Coast region. You can see our region highlighted in green on this map. This includes some very convenient locations which are a short distance to Sydney. For example, Newcastle is a 2-hour drive away, or the Central Coast is just over an hour's drive away from the Sydney city. This slide is a little snapshot of our region. The Hunter, New England and Central Coast region has a bit of everything. Some of the country locations in our Hunter and New England regions in particular offer more freedom and a more relaxed lifestyle. And as I mentioned earlier, in the Newcastle and Central Coast areas, we have city convenience and beautiful beaches with a close proximity to Sydney. So here's a flowchart of the expedited specialist pathway process, which is a slightly simplified version of the flowchart from the website of the Medical Board of Australia. It's important to note that this is just the process from the Medical Board, and obviously doesn't delve into other aspects of the process, such as visas and other complications that arise when moving overseas. The first step is ensuring that your medical degree is recognised by the Australian Medical Council and the World Directory of Medical Schools. The Australian Medical Council has a section on their website where you can check this. The next step is checking if your GP qualification is on the expedited specialist pathway accepted list. I'll put up a slide with resources at the end of this webinar, which includes a link to the Australian Medical Board where you can check this information. You can then apply to the Australian Medical Council for primary source verification of your primary medical and specialist qualifications. Step 4 is securing a suitable position, which can be done when you apply for registration or after registration is granted. Included in that resources slide at the end of this webinar will be a list of vacancies from our website where practices have indicated that they are looking for a GP via the expedited specialist pathway. Following that, you can apply for specialist registration to the medical board under the expedited specialist pathway. This is the point in the process where you could become a member of the Royal Australian College of General Practitioners. Our speaker Kylie will give some more information on this later. Once you commence your new position in Australia, you're required to undertake 6 months of supervised practice. During this period, you submit your supervised practice report and orientation report following 3 months of practice. To finish the process, complete 6 months supervised practice, any required workplace-based assessments and any other additional requirements, and submit a supervised practice report following 6 months of practice. Then finally, apply to remove registration conditions. So we have grants available. Who are the grants for? The PHN has a limited number of grants of 10,000 Australian dollars to GPs who come to the Hunter, New England and Central Coast Primary Health Network region via the expedited specialist pathway. The purpose of these grants and this webinar is to help attract GPs to our region, and so the entirety of these grants go towards the GP, not towards the practice. How do you apply for these grants? Eligible GPs require a signed contract with a practice in the Hunter, New England Central Coast PHN region. The practice is then responsible for making the application for the grant. These applications are open until May 31, 2026, or until the allocation is exhausted. To learn more about these grants, I'll link to the aforementioned resources page at the end of this session, which includes a link to more information on the grants and the grant guidelines. Right, now I'll stop speaking and pass over to Dr. Paul Craven to speak.
Thank you very much, Jeff. It's lovely to be here this morning, and I'd also like to acknowledge the traditional owners of the lands we're meeting on today, and I'm also on a Worimi and a Awabakal land as well. So it is wonderful to meet everybody this morning, and I thank the PHN for inviting me to talk this morning. As Jeff said, and I don't work directly for the PHN, I work alongside the PHN. I am a neonatologist by training. I trained in the UK. I loved working in the UK. I loved working in the NHS and living in London. But in 1999, I chose to move to Australia for 1 year. That's what I told my mum. And at that stage, I came over here to work for the Flying Doctor Service for Children. And I absolutely loved it. Not only did I come over here and have amazing opportunities to do something I had never done before, I also moved to a country which gave me so many opportunities with that work-life balance as well. And living somewhere where the sun shines 300 days a year does really make a difference. So I just looked at the weather forecast today just to make sure I told you the correct things. But 27 degrees today, and I will say it's 7 o'clock in the morning here. And I've been up to the gym, grabbed a coffee by the beach, and still been in work by 7 o'clock. So I can tell you it is pretty good living down under and pretty good in Hunter, New England as well. I will be honest, I moved to Sydney to start with, where I did work for 5 years. I was training as a paediatrician in the UK and then trained as a neonatologist in Sydney. Loved every minute of that. And to get my residency, I moved to Hunter, New England to Newcastle. Again, I do everything for just only 1 year, I think, and moved to Newcastle thinking I was moving back to Sydney. But after 1 year, to be quite honest with you, moving to a local health district, and it's one of the 2 local health districts representing the PHN, I just absolutely recognise the benefits of living here. So I moved to Newcastle, which is the coastal city of this region, and I work within the Hunter, New England local health districts, as I said, one of those 2 LHDs. In that LHD, we employ about 22,000 people. We cover an area of 130,000 square kilometres. We have about 1 million people living in Hunter, New England. As a tertiary hospital working in this area, we do cover other districts surrounding us, so the Central Coast, which is below us, above us the Mid-North Coast, on the Queensland border, the northern New South Wales area, all areas that Jeff and Phoebe were alluding to before, and also we do cover out west as well. We do have 9% of our population who identify as being Aboriginal in this region, and it's one of the largest Aboriginal populations in the country, and it's an absolute pleasure to work alongside my Aboriginal colleagues and to care for Aboriginal people in this area and ensuring that we provide world-class healthcare and closing the gap as well. Of note, and the reason I wanted just 5 minutes to talk to you was that we do have 39 hospitals in Hunter, New England, and 60 health facilities, and we work very closely with our primary health colleagues across the district. So we offer opportunities for general practitioners who may want to combine their work in their primary health setting with work in our hospital setting as well. And very often, many of the primary health providers in our regional settings choose to work in our hospitals as well. In our smaller hospitals, of which we have many in towns across Hunter, New England, the GPs who work in their own private practices will work in our emergency departments after hours or care for their patients when they're admitted to our hospitals. We have a variety of ways of employing those general practitioners. Either we pay them for the work they actually do, or we pay them a sessional rate when they're actually working in a number of hours within our health facilities. And we are aiming to be as flexible as we can, which really suits what the primary health providers want to do within our health facilities. For those who work more in the metro sites, where we might have specialists in many of our emergency departments or our specialist services, We do have many GPs who also work in those areas, and we are really fortunate because many of those GPs come in and really help us. And just a few of the areas I can think of, we have them working in our maternity services, we have them working in our ear, nose and throat services, we have them working in our virtual care services. And one of the services, or two of the services I run, one is the a service, virtual kids service. It is a service where parents in the region can make a direct call to what we call Health Direct, which is an online virtual triaging service. And if the Health Direct service feels that potentially you might need hospital care, they can refer you direct to a virtual children's service. That virtual children's service is run very much by many of our local general practitioners. And I'm delighted to say that we know that when children do present through that service, about 80% of those children do not end up coming to our emergency services. And we never see them in the hospital, so an amazing service. And again, we employ those general practitioners into the hospital on sessional contracts. We pay them for the days they would like to work. There is no pressure on when they would like to work. It's very much a choice at that stage. So really my opportunity was to say hello to everybody this morning. Really tell you it is an amazing place to live and to work, and it doesn't matter where across Hunter, New England, whether it's on the coast or whether it's inland in some of the best countryside that you could possibly wish to live in at that stage. You can have a lifestyle, whichever lifestyle you want to choose, you can find it in Hunter, New England. It is the only district in this state where we have metropolitan hospitals, regional hospitals, rural hospitals, and remote hospitals as well. So for those people online, what I'm going to say is that you are lucky to be here today, and I look forward to meeting you all when you choose Hunter New England Central Coast Primary Health Network. So thank you.
Oh, thank you, Paul. I really appreciate that. I'll now pass over to Katrina from the Welcome Experience. Katrina, I think you're on mute.
Sorry, here we go. The coffee hasn't kicked in yet. Good evening, everyone. I'm going to say that I was going to up Dr. Craven in terms of the temperature today. We'll have a lovely 28 degrees here in Muswellbrook. So the area that I cover is from Muswellbrook to sort of the Upper Hunter area and also slight Lower Hunter area. And my role is to really support essential workers moving to our town. Now, in terms of doctors, I have helped many a doctor emigrate to Australia. I'm currently supporting 4 different doctors from Johannesburg, Iran, the UK, and Pakistan actually moved to our space. One of the main things that they love, and the ones that I have supported who've moved here in the past sort of 6 months, is that real work-life balance that Dr. Craven spoke of. You know, the variety in their work as well. We live in quite a sort of an agricultural and horse capital of Australia as well. So there's a real variety in the type of patients that you'll actually be treating. And doctors are certainly very well lauded in this area. Quite a few of the doctors that I have settled recently have joined, you know, the local golf club. They're playing tennis, and they all say that these are the kind of opportunities that they would never have had previously in their practices, where they were just working absolutely crazy hours and rarely seeing daylight. So I think certainly the lifestyle balance out here, so whether it's coastal or inland, the opportunities are ripe for a great life, really. One of the things that I do, and also Kate does, is we really support essential workers moving to the area. So for those who are looking to emigrate to Australia, it's everything from helping you find a suitable rental, some are looking to purchase off the bat, getting your children into suitable school, from, you know, getting the animals over into Australia and dealing with the sort of the immigration process around that, to really just connecting you in with social groups. Because one of the big things about when you move overseas is really finding a tribe. And we run lots of different events where we connect you in with other medical professionals and also just locals as well. So whether it's pistol shooting, which we've done, you know, making sourdough bread, it's really sort of getting you out of your comfort zone and providing some opportunities. The great thing about it is when you do sign up and decide that you do want to move to the area, I am your go-to person. So you won't be handled to anyone else. you'll have me from woe to go. So that can be a good thing or a bad thing. But the great thing is there's no AI, there's no chat GPT. It's me from woe to go, and it's a free service. So we do work closely with Primary Health Network. I have helped them with quite a lot of doctors that moved into this region. And as I said, it's a free service. It's anything and everything. I know that Jeff will be providing information on the work that I do, but if you have any questions, by all means, please shoot us a message, because we're here to help and make your life easier. And if you're sitting on the fence about making the move, please don't. Honestly, life's short. I've lived in many countries and places around the world. I moved from Sydney a few years ago to the Upper Hunter region, and there's zero regrets. Like, I absolutely love it. I've got the lifestyle that I want. I'm trying to talk very quickly so that my rooster doesn't cut into this call as well. I've seen kangaroos running past my desk this morning. It's cliched, but it's completely true. So, 2026 is the time for change, and hopefully we'll see you on this side of the world very soon. Thanks, Jeff.
Katrina, did you want to go through any of these slides, or just leave them on the last slide maybe?
We'll
with the
leave them on the
QR
last,
code?
I think. Yeah, it's got all the information and all the sorts of services that we provide. As I said, it's completely free. So, and there's a lot there. It's all the life onboarding, so to make your move to Australia a whole lot easier.
Great. Thank you. I'll now pass over to Kate Dunn, the Community Connector at Midcoast. Oh, Kate, you're on mute as well.
Okay, there we go. Hi, I'm Kate. Going off what Katrina said, I do basically everything that she said that she does for her region. I do just a little bit north. If we're looking at the slide number 15, we're called Mid Coast, but also Barrington Coast. The council has done a bit of a rebrand over the last few years. So you'll hear me talk about Mid Coast, Barrington Coast, but within the region, we have quite a number of smaller regions within that: Great Lakes, Manning Valley, Gloucester, Barrington Tops. And the good thing is that we are, you can say you're moving to a country town, but we're still in close proximity to Newcastle Airport, which is an hour and a half away, which has now gone international. And then we've got Port Macquarie, which is just a little bit further up, which has, hourly flights to Sydney, Melbourne, Brisbane. So the best thing I say about our region is that you have everything within 30 minutes. So you can live on the coast, you can live on the river, you can live in the bush, you can live in heritage country towns. Everything's within 30 minutes. So again, it's the lifestyle, it's the weather. Through our program, we've relocated over 150 professionals in the last 2 years, and that's with their partners and children, over 300 people that have relocated to our mid-coast region. We have like 5 coastal lakes and lagoons, 38 rivers. We've got the only double delta river. Our coastline for the mid-coast, Barrington Coast, is 192 kilometres of beautiful coastline. We have Ellenborough Falls, which is the largest single drop in New South Wales, but also one of the largest in the Southern Hemisphere, which is a big tourist attraction for us. When we're looking at the slide number 17 for the region, if you're living in the coastal areas, obviously at the beach, as Paul was saying, even myself yesterday morning, I played tennis at 6 a.m. Then I went for a coffee with friends, and then I started work. Last year, through our program, we brought in 40 nurses for the local hospital from England and Ireland. And the number one reason why they were relocating was for the weather. So as Paul was saying, we've got over 300 days a year of just fabulous weather. So that's obviously something that is extremely beneficial for everybody. A big thing that people say when they're moving to our region, because we're not a big city area, we do have small towns along the coast. And the big thing is community. So I have a conversation with everybody who's even looking before they've accepted a role or looking at what they're doing. I have a talk about what's the needs for them and their families. And then we talk about the different locations where it may suit them to live and what they want from their community. And obviously looking at every aspect, partner employment, schools for the children, and things like that. Another big thing, because we're not in a major city area, is the cost of living. So obviously after COVID, we had a lot of people moving from city areas, and we continue to do so. We have a small town just 10 minutes from Tari, the hub of Tari, called Old Bar. A few years ago, it was actually the fastest growing primary school in the state, which shows that there were so many young families moving to the area, which is fabulous to see. Foster, 30 minutes away, is a really great place to live. Actually, it was voted second best place in Australia to retire to. So there's a lot of young families moving to some of the towns. There's a lot of people moving to retire as well. So it's all really positive. On the last slide, which is number 18, I've put a couple of websites. So there's the Community Connector website, which is the program that I run. If you go on there, we've got the top reasons to move to the area. We've also got a number of short videos around 3 minutes long, which have stories of people who have already relocated to the region and their experience. So I encourage you all to go and look at those. People who have relocated from other areas within Australia, but also international arrivals. So they're really good to look at. And then the second website I've put there is the Barrington Coast website, which is our local council government website, which was set up initially actually for tourism purposes for people to visit. But it has information on every town, places to live, restaurants, current events, day trips where you can explore in the region, and a full directory of everything in every town. So it's an amazing resource for people looking at the Mid-Coast, Barrington Coast region. And then finally, please reach out to me, even if you are just looking at it at the moment as an option. We are a free service. We're state government funded, so I'm happy to work with you to even look at different regions or opportunities for yourself, your partners, children, to learn a little bit more one-on-one. I'm happy to do that for you, and I obviously encourage. I think the region is fantastic. I live and breathe it, and I love to educate people about the region. So any questions, please come and contact me. Yeah.
Awesome. Thanks so much, Kate. Really appreciate you being here. I'll now pass over to Dr. Michelle Redford and Dr. Eamon Halatethi.
Thanks so much, Jeff, and thanks everybody for being here. My name's Michelle. I'm a GP. I moved to Australia in 2014 with my family, including 2 primary school aged children, and having trained in the UK and worked as a GP in the NHS for over 10 years. And I echo what Paul says, that it's not that there was anything wrong, but that coming to Australia has given me and my family opportunities that I wouldn't otherwise have had. And I'm very glad to be joined by Eamon, who has made the journey much more recently than I have, and he's going to share a few reflections. I'm just going to mention a few differences between NHS-based general practice work and Australian general practice work. The first thing would be that as a GP in Australia, it's much more of a choose your own adventure, I would say, that you can mix and match the type of work that you do much more easily. You have more autonomy clinically, and with that, comes some maybe initial discomfort if you've been used to working in the NHS. I would certainly say that when I first came, I did miss having some of the guidelines, procedures and protocols that I like. And so if you're like me and you like a guideline, procedure and protocol, then it can be a bit unsettling at first. But you very quickly adapt to that, and we have a range of resources to support GPs in their daily practice, including something called Community Health Pathways, which summarises all of the kind of local information for referral and management across a range of conditions. So I think the autonomy is both in your clinical life and to pursue non-clinical interests is a major difference between NHS and in other countries and in Australia. So I'll pass over to Eamon, and he can give us his take on his journey and how he's come to be working in Swansea. Thanks, Eamon.
Thanks, Michelle. Yeah, thanks. So my name's Eamon. Like Michelle just said, I've made the move a lot more recently. So, this time last year, I was working in the UK. I didn't even have a plan to move to Australia at that point. So, in the space of just less than 12 months, it's all sort of happened. So, it can be quite a quick process, especially now with the expedited pathway. It can make the process a lot quicker. So, I'll just go through a bit about my journey. So, I can go on to the next slide. I won't take too much time, but it's just a bit of a brief sort of background into how I've got here, why I chose Australia, starting the process and how you sort of find a job, a little bit about the actual expedited pathway and what that means, obviously making the actual move and how that worked out, and obviously since I've been here, what's life like being a GP in this area. So first of all, about me. So my name's Eamon. I'm 35 years old. So I did my university in University of Leeds, qualified in 2014. Sort of stayed in the north of England, so moved to Manchester and worked in Bolton. So did my foundation in Bolton. After my foundation years, I did do a bit of travelling for about 6 months, mainly Southeast Asia, and I did come to Australia for about 3 weeks, I think, 3 or 4 weeks. Came to Sydney, Brisbane, and then flew to New Zealand for a few weeks as well. So that was the only time that I've ever been to Australia before. So I've never been to Newcastle, Hunter region. I've never been here before. So literally the first time I arrived is when we moved all our life here. So it's quite a sort of bit of a scary thing to do, but I think it was worth it. So in terms of how I worked in the UK, so I was a locum GP since I qualified in 2020. So the main reason for that was just to try and get a bit more flexibility. I think the sort of the way the NHS has been with sort of how the sort of workload for salaried GPs is quite intense. Obviously, being a partner is very demanding as well. So it's not something at that time in my career I didn't really fancy doing one of those jobs in the NHS. And then, that's sort of one of the reasons why I sort of made the decision to move. If I don't want to be a salaried GP, I don't want to be a partner in the UK. It's what do I want to do? And that's when it sort of started to think about the next steps, really. So I also moved with my partner and my 4-year-old Lily. So just mainly for the quality of life and to give her a better life moving forward as well. So why did I choose Australia? So I guess the most obvious, easy reason to begin with is that it's an English-speaking country. You have direct sort of qualification, just moves straight across. You don't need to do any more exams. And you've also got now the expedited pathway. So that basically means that you can just get registered with APRA relatively quickly. You just have to fill out some forms, provide some evidence of your qualifications, and then you can get sort of basically registered straight away. So it's a big advantage to be able to do it quickly. In terms of other things, so you've got your lifestyle, obviously, beaches. We've got a lovely lake here, Lake Macquarie. So lots of outdoor activities, walks, hikes, beach, spending weekends at the beach, barbecues, all the sort of things that you think of, it is possible to do. So that's one of the reasons why I moved to Australia. You've also got the healthcare system, which is a bit different to the UK as well. So as someone who just moved here, I'm only in my 4th week of working, so it's all a bit of a whirlwind at the moment. So I'm still learning the processes, I'm still learning how it all works. But the main sort of differences that you'd get in Australia, so the big difference is that you get paid per consultation. So when you see a patient, you get paid for that appointment. So it's not like in the UK where you get whatever £1.60 or whatever it is per year per patient to look after them. yeah, you get every time you see that patient, you get paid for it. So, and that's partly funded by something called Medicare. So Medicare basically will pay a portion of the consultation depending on how you bill the patient. So so that's one of the differences as well, is that you can choose how much that you charge to see a patient. So it's you've got your own autonomy with that. You can do whatever you want basically. You could, if you wanted to charge $500 for an appointment, you can do that, or you can also charge a lot less. So there's a few different types of practices that you come across. So you have a private practice, bulk billing practice, and mixed billing practice. So in a private practice, all of your patients will be paying a private sort of appointment cost. So some of that will get rebated by Medicare, and then the rest of it the patient has to pay out of pocket. So again, you can choose how much that difference would be. So the patient pays whatever you want them to pay for that appointment. You have a mixed billing practice, which has a mixture of bulk billing and private billing. So that's the practice that I'm at the moment, is a mixed billing practice. So basically for all children, pensioners and patients with health cards, so people on like pensions or benefits and things, so they basically can get the appointment bulk billed, which means that they basically don't pay anything out of pocket, and then the rest of the patients will pay a small sort of gap fee on top of the rebate. So the standard sort of appointment that you get, so if it was a private patient, it's about, in my practice, $85. And then of that, about $45 gets rebated to the patient, so they pay about $40 on top. There's also a new thing that's just come in at the start of November, a new incentive for bulk billing. So our practice hasn't decided to go ahead with that yet, but they are thinking about it. Basically, if you decide that you're going to bulk bill every patient that you see in the whole practice, the government's going to pay an extra sort of incentive on top of the normal Medicare rebates. So for practices that are mixed billing, or if they have quite a high proportion of bulk billing, it should actually be beneficial to switch over to completely bulk billing. So that's something that we're going to be thinking about as well. Yeah, so in terms of the actual work and working here, so yeah, like I said, the main difference is to do with that consultation model and how you get paid. But the other difference is that you got a lot more, like Michelle said, a lot more autonomy to do what you want to do. You can have a specialist interest. You can, if you really like the menopause, you can sort of advertise yourself as a menopause specialist, for example, get patients to come and see you for that. You can choose your hours that you work. You can say, I want to see this many appointments in the morning, I want this many appointments in the afternoon, I want Tuesday afternoons off, I want, whatever. You can sort of do how set up your clinic how you want. You are sort of classed as like an independent contractor, so it's not like a salaried employee. So yeah, obviously that does come with some negatives, that you don't get, the access to paid annual leave, sick pay, that sort of thing. So it's similar in that way to working as like a locum GP in the UK, but you've got your, you're in the same stable, safe job, and you've got your sort of guaranteed patients coming to see you. So, so yes, that's one of the differences. In terms of like just from the first few weeks of working, the sort of initial benefits that I've seen already. Things like getting investigations and getting things done for the patient is a lot easier here. So for example, I saw a patient last week, so about a 15-year-old girl. She'd had a knee injury playing football. Examined her, arranged for an x-ray straight away. She had the x-ray the same day, and the report came back to me about 2 hours later, and the x-ray showed a possible osteochondral fracture. So I brought her back the next day, saw her again, arranged for an MRI scan. So she went for an MRI scan of her knee the next day, and the result came back to me the following day. So the whole process of getting an MRI done took about 3 days. Then I referred the patient straight away to see like a sports injury specialist. So she went and saw someone sort of the next week. So if that was to happen in the UK, it would probably take about 6 months to refer to an orthopedic clinic. You can't refer for an MRI scan yourself, so they might then go for an MRI, and that might take another few months, and then you're onto sort of 12 months, and this a child who's got like a significant injury of a knee, unable to play sport, and not able to get the sort of access to the help that they need, really. So those things are very, very good here. And the investigations are all bulk billed as well, depending on the reason why you refer for them. So the patient's not paying loads of money for the MRI scan. Often you can get them bulk billed as well. So also you've got the main difference with seeing a specialist as well. So starting to come a bit more, I think, in the UK with the private sector, but here we have a big mixture between private and public. Unfortunately, there are still similar waiting time problems that you have in the UK for the public sector. So, if you wanted to refer someone to, I don't know, for example, like again, an orthopedic specialist, if you're referring through the public system, there'd be a lot longer waiting list for, say, a knee replacement. But a lot of people in Australia will have private health insurance, so they, often doesn't, it's not like the patients again paying a lot out of pocket. They've already been paying for their insurance, so they can go and see like a private specialist as part of their insurance as well. So so I think the system does work a lot better here, just in the sort of short time that I've been here. So yeah, there's definitely been a positive transition so far. Okay, so how did I get here? So it's a little bit of a daunting task initially. So Australia is a very, very big country, which you sometimes don't realise. I think the world map is not sort of to scale. So if you actually look at how big the region is, there are some websites that I went on where you can move bits of the map and see how big they are in different places. And Australia is huge. And I think the UK, in terms of the region that we're talking about, Hunter, New England, and sort of Central Coast, it's probably bigger than the whole of the UK. So it's quite a big region really. So the first thing that I would sort of recommend doing is to first of all just try and choose the rough location that you want to be living. Like we said, Australia is big. You think of the big cities. You do have that lack of being able to move straight away to a big city, so you can't work in Sydney, Melbourne, Brisbane, sort of centre of the cities, and Perth initially. So you have to choose what they call like a rural area, which does sort of mean that you can't move to those main parts of the cities. But yeah, there's still a lot of different areas that you can move to. So the first thing I'll do is to try and choose a location. So things for your life, how you want to live your life, what sort of weather do you want, what sort of climate, do you want to be near a beach, do you want to be near the bush, you want to be able to hike, do you want, I would probably choose that as the initial sort of thing for sort of choosing a location. So for me, I would say this area has all those things. So it's a great region, and it's quite unheard of as well. So not many people have heard of Newcastle, the Hunter region, Central Coast. It's not something that a lot of people know about in the UK, so it has got that advantage of being a bit more of a hidden gem. I would definitely recommend this area to sort of look at if you wanted to look for somewhere. In terms of other things, is whether you want to choose to go through an agency or find work yourself. I chose that I didn't really want to go through an agency because they do charge the practice a lot of money. So I wanted to sort of try and find the work myself. So how did I do that? So the way that I found this job is by going onto the PHN website. So Michelle actually shared that to me about a year ago, just less than a year ago. And I went on the website, looked through the job offers that was online. So this is not something where the practice is paying for an agency, it's just job adverts online. So I emailed the practice about a few days later. I had an interview, and then I got offered the job after about a week of actually looking for a job. So this is about January, I think, of this year. Within about 2 weeks of actually deciding to look for to think about moving to Australia, I'd already had a job offered to me. So one of the main sort of shocks when I did this is when I went for the interview. So I had a Zoom call with the sort of partners at the practice. I was expecting to sort of get, grilled a little bit, ask me a few questions like, maybe a clinical scenario, or trying to find out if I'm actually, good enough to do the job. But it was actually probably the opposite of that. They were trying to sort of sell the place to me. So obviously they're quite desperate for GPs here. So they were telling me how good it was, what the room was like, the practice is new built, and got access to lots of patients. We'll get full book straight away, and all these sort of positives. So I think it was more them trying to sort of interview themselves rather than interview me, really. So it was it's definitely quite a good process for that. Once we had the job offer, so basically there's a few things that you can negotiate yourself with that as well. So a lot of practices will guarantee an initial income for you. So when you're first starting and you don't really know how the billing works and you've not got full patients maybe straight away, they do sort of guarantee you like an hourly rate whilst you're working. So it just means it's a bit more stable income when you first start. So yeah, that's how I sort of negotiated with my job. Other things you can get is like a relocation package where they give you like a lump sum to help you move. Yeah, again, that can be good. Possible negative to that is often it comes with like a binding contract that if you sort of leave the practice after less than what they want you to leave, you sort of have to pay some of that money back potentially. So that's one of the negatives to a sort of a lump sum. But yeah, then once you've sort of got into that process, you can then move on to the APRA process, which is the sort of specialist pathway. So yes, it's obviously designed to make the process quite quick. And yeah, like Jeff already said at the start, you have a 6 months period of supervised practice, and then you have to do a few self assessments while with your working. So like an MSF, a CBD, and you have to do a few sort of courses within the first 6 months, but that's basically it. So although it is a supervised practice, it's basically like you're just working as a normal GP, just you've got another GP in the surgery that you can just ask questions to, and they review you. You might have a chat at the end of the day about your patients, but that's about it really. So that's a picture of Lake Macquarie, by the way. It's took that the other day. So that's nice. That's about a 5-minute walk from my practice, so I can go for a walk at lunchtime. So I'll just quickly go through my timeline of how long it took me. Like I said, I only started looking for a job in January. Had an interview on the 15th. Once that was done, we had to sort of get all my evidence for APRA. So that took me a couple of weeks just to get things from the GMC and had to get my documents notarized and all that sort of process. But if once the slides get available later, you can have a look at the timelines on the side. I'd sort of put a date for everything that I did and how long it took. The actual process of getting APRA only took, once I submitted it, about 4 weeks. And then I was APRA registered at that point, so it was very quick. The main delay in things was trying to sort out the visa. So one thing that I didn't realise was that the business itself, so the practice, has to be a sponsor to be able to sponsor the visa. So I assumed once I had the APRA registration, I could just apply for the visa straight away. But unfortunately, the practice, because they've never sponsored a visa before, they had to then apply for sponsorship, which actually took about 4 months for them to get that. So after I had my APRA, I was just sort of waiting for about 4 months until I could submit my visa. So a piece of advice I would just ask the practice to make sure they've applied or they already have business sponsorship application. So once the practice has that, that means they can sponsor anyone's visa for about 5 years, I think, and then they have to renew it. So as long as they've already got that in place, or if they've applied for it, then you're not going to be waiting too long for that. And the actual visa itself, once I could do it, so I was getting a bit nervous because I was planning to move in October, and it still hadn't sort of got the I hadn't even submitted my visa by August, so I was a bit sort of worried at that point. But the actual visa only took about 5 days to come, so it was the 482 visa, so it was very quick as well. So yeah, if there wasn't that 4-month delay, it could have potentially even been like a 6-week from start to finish potentially. So yeah, so it can be quite quick if it goes smoothly. And there's a few other things you have to do as well, like your Medicare provide a number of things, but that's fine. And then yeah, so I flew to Australia on the 19th of October. So yeah, about 6 weeks ago. In terms of the sort of costs to emigrate, so obviously there's a lot of costs initially to get over here. So like I said, some of that can be given back to you by things like the grant, obviously the grant which is available for new GPs, so that would cover quite a large portion of this if you could get that. Plus also the practice sometimes can give you help with some of these things as well if you negotiate that. In terms of my costs, so there's a few different steps you have to do to get the APRA, and then the application for APRA as well. And then visa stuff as well. So that was for the visa for myself, my partner, and my 4-year-old. So the total was about £9,000 for sort of everything, including the flights as well. So yeah, so obviously flew to this place that I've never been before. So arrived in Newcastle, actually drove from Sydney Airport to Newcastle. On the way I stopped off at the practice. So on the first day of being in Australia, I sort of drove into the practice, said hi to everyone. Everyone's very friendly. I've got a nice big room, as you can see behind me. So I think it's one of the biggest room in the practice, so it's quite nice. And yeah, so then we sort of, I didn't work straight away, so I had about 3 weeks off before I sort of started. So first couple of weeks just exploring the region. So we stayed in sort of centre of Newcastle, lots of beaches, parks, going to see some wildlife, lots of different activities that you can do with kids. There's a good website, it's called like Nui with Kids. It's got lots of loads of different things that you can do with kids around the area, and lots of different parks and free stuff and other things. So and like we said, also it's very close to Sydney. So there's a direct train to Sydney from Newcastle, and you can drive in sort of 2 hours as well. I think I've booked a few shows in at the Opera House for the next few months. So there's a Bluey's big play that we're going to go and see with Lily. And there's another one that we're going to see in January as well in Sydney Opera House. So it's definitely lots of options available to do different things. So Newcastle's quite a small city, but it's got lots of amenities, and everyone's very friendly. One good thing is there's not very much traffic. So I mean, obviously coming from the UK where we'd be stuck in a lot of traffic in the mornings, it's I've got about a 20-minute drive to work, but it's just driving along the front of the lake. You can see the sea on one side, the lake on the other side, and there's no traffic, so it's a lot nicer than the commute in the UK. So yeah. I mentioned before about Lake Macquarie, so that's a large sort of saltwater lake, which is again lots of water sports and different fishing and jet skis going on there, and boats, and it's a very large lake, and around the lake there's lots of different sort of small town areas, and a lot of these places are definitely looking for GPs. So there's you could sort of choose any of those little lakeside places. So I've ended up in Swansea, which is on the lakefront. It's also next to the sea as well. So there's Caves Beach, which is one of the top beaches in Australia, I think, on the rota this year. That's just next to my practice, and then I've also got the lake on one side as well. So I'm also living in a place called Warners Bay, which is on the lakefront as well. So I've got views of the lake from the balcony, which is nice. So how's my life been so far? So like I said, I've been working for this is my 4th week now. So there's a big demand for GPs. I basically decided to try and get some new patients at the practice, because the practice I've been at has not had any new patients for about 6 years because they've been full. So I put a post on Facebook on the Swansea community group. I just thought just put a quick Facebook post on, just say I'm just come to the area and I'm looking for for new patients. So I went out for my lunchtime walk, and that's my walk there. So this is about 5 minutes from the practice. You can walk along next to the sea. So I went for my walk, came back after about an hour. The receptionist was like, "What have you done?" I was like, "What do you mean, what have I done?" He said, "Oh, you mean the Facebook post?" And I checked my phone, there was about 200 likes. And apparently the phone to the practice hadn't stopped ringing since I left, with people trying to book in to get an appointment. So definitely a high demand for sort of for GPs here. So a lot of people have been living in the area for sort of 3-4 years, not being able to register with a GP because all the books are closed. So yes, it's definitely, if you do come, you'd be in quite high demand. So like I said before, you can choose your own hours. You can see how many patients you want. If you want to I like to go for a walk every lunchtime, so I'll go for a half an hour walk, and you can just factor that into your day. So get your steps in and things like that. Things work slightly differently with things like pathology and things here. So there's you don't do your own blood tests. Basically, there's like a pathology service which does the blood test for you. So you don't have to do any blood tests. So you just give the patient a form and they can get the blood test done straight away. It's actually attached to the surgery. You also got the scope to do other things as well. If you want to do things like minor surgery in the practice, they've got like a theatre, like an operating room and things like that. So in terms of final tips, I think Australia's got a lot to offer. It's a great place to bring up children. Great lifestyle. You've got all the things that you need here. You've got better work prospects and better pay. So I think probably double pay to what you get as a salaried GP in the UK. I think is quite easy to do. It's quite realistic. More of a traditional sort of family doctor role. So once you've got your own patients in the practice, you'll see them every time. So you're not seeing, in the UK, you're seeing a different doctor every time you go to see the doctor. Here, they'll just see you every time. So you get a lot better continuity of care. You can build a relationship with your patients. You can be in charge of your own working schedule. And yeah, I think the region itself is a bit of a hidden gem area, and yeah, it's got great links to Sydney, and yeah, all the sort of lifestyle stuff that you need really. So yeah, so that's my my. I was supposed to be brief. It was a bit longer than I was expecting, but that's fine. It's just quite useful to sort of find out just from someone who's just moved across. So yeah, the process does work well, and it's yeah, you can settle in quite. I was quite nervous the first week of working, but once yeah, I feel fine now. It's quite straightforward, to be honest. It's not much difference to working in the UK really.
Amazing. Thank you, Eamon. I really appreciate your time and hearing your personal experience in moving down to our region. We're a bit short of time now, about 5 minutes left in the webinar, so I'll just quickly hand over to Kylie from RSCGP to go through her slides before we cap off the webinar.
All right, thank you. Welcome everybody. So the RACGP's role is to be the voice of general practice. We perform other roles as well. We're a CPD home. Any doctor in Australia, once you get medical registration, you need to have what's called a CPD home. We're the biggest CPD home in Australia, and that's one of our roles. We advocate for the profession and we set the standards for education and practice. And the RACGP has also been quite proactive with the Expedited Specialist Pathway, and they've appointed me to be the support person for doctors considering or already on the pathway. So I can give you, I can support you with different aspects of getting through the process and completing your CPD as required. We've also developed an orientation that goes alongside AHPRA's orientation that you're required to do as part of the Expedited Specialist Pathway. And that orientation, it's very comprehensive. It covers everything that you need or that AHPRA has specified, and because it's developed by the RACGP, you know that it's accurate information and it's the most up-to-date as well. We recommend doctors on the pathway do start our orientation, perhaps while they're organising the other parts of coming to Australia. And the idea behind that is you can get a lot of the reading, a lot of understanding on the Australian medical system started and often completed before you arrive, before you're starting to, you know, before your children are in school and you're negotiating that, before you're in a new environment, a new practice. You can have that understanding of how it all works before you're actually doing it. We have more than 3,000 learning activities on our portal. We are the college for GPs in Australia. We train GPs as well as support them throughout their career. So our activities are designed by GPs for GPs and continually kept up to date. Once you have finished the expedited pathway, you've finished your first 6 months in Australia, there is an option to apply for fellowship of the RACGP. There's no exams as part of that. It's basically submitting or resubmitting some of the forms that you've already submitted to AHPRA, and we have a short conversation with you. We're calling that a member welcome conversation to welcome you to the college, welcome you to practicing in Australia, and introduce you to our professional community. So welcome. I hope to see you soon in Australia, and the Central Coast holds a special place in my heart. I grew up there, not too far from Sydney, so and it's everything they said it is. It's beautiful. So yes, you can also contact me if you've got some questions. So thank you. Look forward to seeing you soon.
Thanks so much, Kylie. Really appreciate you coming along to the webinar and sharing that. I don't think we have time for questions, Phoebe, do we?
We can. I'm happy just to run through a few quick questions. I think now that we've got the Brains Trust here, that it would be beneficial to get everyone's input. Appreciating that we are a little over time. So we're just going to squeeze it in really, really quickly.
Yeah, no worries. I just wanted to mention as well that we've got this slide here that has a QR code to resources on our website, as well as a form to contact us following the webinar if you'd like to reach out.
Amazing. Thank you. Thank you to all of our presenters, especially Eamon. Wonderful. Really cool to hear your story. So just quickly going to run through the questions that have come through. Thank you to everyone who has sent through a question and makes these things a lot more interactive and fun from our point of view. So thank you. How, as an IMG GP moving to the region, how does opportunities to upskill work? For example, anaesthetics, emergency medicine, what needs to be considered and support for this, as well as a realistic timeline?
Okay, well, your first job is to get your registration completed through the 6 months of supervised practice on the Expedited Specialist Pathway as a GP. So that's your first 6 months. After that, and actually during that time, you could investigate opportunities within the hospital sector, as Paul Craven had outlined, and that's really where those sorts of opportunities to upskill in anaesthetics or in other sort of hospital-based specialties would sit. A lot of those opportunities are available more regionally or rurally, but beyond that, it's probably more in Paul's scope to answer more, with more detailed timelines. But yeah, your first focus would need to be on the 6 months of becoming fully registered as a GP.
Amazing. Thank you, Michelle. Paul Craven did leave his email address in the chat. So if you wanted to reach out to dig into that a little bit further, please feel free to do so. So, Eamon, I see that you have answered this in the chat, but I would love for you just to provide some commentary around it, if that's okay, around the specialist pathway being available to anyone finish the MRCGP from any country.
So MRCGP means that they've done their training in the UK, so that's what MRCGP is. So so obviously you have people that did medical school in the UK who then do MRCGP, or you have IMGs that medically trained abroad and then they come and do MRCGP in the UK. So anyone that's got MRC, from my understanding, might be wrong, but MRCGP, once you've got that qualification, that means that you can get it transferred across. Obviously with the APRA applications, there's different evidence that you need to provide, so you might have to do potentially language, and even for the visa as well, potentially language skills, other sort of things to sort of say that you're okay to come across. But yeah, in terms of the actual qualification itself, the MRCGP, that's the one that you sort of need to get transferred to APRA. So yeah, it should be fine.
Amazing.
And just be aware that your primary medical qualification does also have to be on the list. So that's that 2-step process. So okay. And the vast majority of primary medical qualifications are on the list, but just to make sure that that is correct as well. Yeah. So
right. Thank you. Do you and the RACGP support those who would like to switch from the PEP to ESP pathway?
Sorry. We understand that choosing a pathway that's most appropriate for the doctor is up to the individual doctor. And yes, we'll provide information and advice on both pathways and facilitate that change if required.
Okay, great. And just a question that has come through asking if you can work as a VMO.
Yes, so once you've had all your restrictions removed on your registration, so after your 6 months of supervised practice is completed, you're fully registered with APRA, then you are equivalent to any other GP, Australian trained or otherwise. And so if there are VMO positions available, you're eligible to apply for those if you've got the skills, it's an equivalent. So there's not a restriction in that way. You still will have a restriction as an overseas trained doctor with the 10-year moratorium. So in some roles there may be some geographical restrictions. So as Eamon mentioned, we have to initially work in specific areas which are on the Doctor Connect website. So for us in Hunter New England Central Coast, the whole of our region is eligible. So we don't have any restrictions within Hunter New England Central Coast, but in other parts of Australia, there may be restrictions on where you can work.
Amazing. Thank you. I wanted to thank everyone for joining us today. It's been an absolute pleasure. Thank you to our Brains Trust, all of our presenters. Really, really appreciate it. And I probably won't see any of you before Christmas. So have a wonderful Christmas break. Celebrate safely with your families and look after yourselves. Thank you so much.
Thank you, everybody.
Thanks, everyone.
Bye, everyone.
Bye-bye.
Thanks. Bye.